Nearly 10% of women in their childbearing years will be diagnosed with PCOS, or Polycystic Ovary Syndrome. While it can be treated, there is currently no cure. Well, here to share more on this condition and advice for women is Dr. Jessica McLaughlin. She's a reproductive endocrinologist at Coastal Fertility Specialists. Great to have you back.
Thanks so much for having me.
So PCOS, this is something that has been around, or doctors have been aware of it for quite some time. Give us a little bit of history on this.
So this was something, it was originally described in maybe the 1930s, but is, affects about 10% of women, and we're seeing it more and more because more and more people are talking about it, which is a great thing. And so it is a common syndrome that has both metabolic consequences for women, but also can really affect a woman's fertility.
Yeah, and it affects up to 5 to 10% of women. So that's a lot of women.
It is, it is.
And how does one know that they could potentially have PCOS? What are some of the signs?
Yeah, so it can be honestly a little confusing, and the S in PCOS stands for syndrome, meaning that you need both clinical and lab criteria, which makes it harder than just a routine infectious disease test. You can't go have it tested. You need a doctor to be able to say, I think you have the symptoms and you meet the lab requirements. So some of the common things women may be experiencing are irregular periods or evidence of having an elevation in male hormone in their body. So they may notice an elevated testosterone that we measure in blood work, or you may notice hair growth, extra hair growth or acne or thinning hair. Those all could be symptoms.
Extra hair growth where you don't want it.
Exactly.
Yeah, and so that elevated testosterone level, how do you regulate that and have a safe pregnancy if that can happen?
Yeah, so it all is related to what are your goals, and that's really an important question for patients. So if the goal is not to achieve a pregnancy right now, really honestly, healthy kind of lifestyle, losing about 5% of your weight will help how insulin works in the body, and that will actually help decrease your testosterone level. But just regulating your menstrual cycle with a birth control pill is another great way.
So does PCOS affect just anybody? Can it affect anybody, or do you have to have a certain lifestyle, as you explain, that lends itself more to PCOS, such as obesity or other?
Yeah, it really can affect anybody. Certainly we think some women are more genetically prone to have it. We may see it within the families, but really any person can have it. Probably 85% of women with polycystic ovarian syndrome have the very classic kind of metabolic considerations. Maybe they are overweight or have high blood pressure or diabetes, but certainly it is possible for a thinner patient, without those more classic symptoms also to have PCOS.
Yeah, because you say that it's genetic. Oh, very interesting. And is it possible to be diagnosed with PCOS if it never ran in your family?
Right.
So it's both. So really it's just kind of luck of the draw, as it were, right? So what are some of the treatments, and how does one gets diagnosed, and then what's the next step?
Yeah, so I think it goes back to your goal. So if we're not trying for pregnancy, we want to help you regulate your menstrual cycle and decrease the male hormone. But if we are trying for pregnancy, there are certainly, and that's what I spend most of my time doing, there are treatments available, and a lot of it has to do with just helping your ovaries to respond better. So first and foremost is obtaining that healthy lifestyle, which is not what patients want to hear, but really can help. Even with a 5% weight loss, women can start ovulating again, which is really great. And then we have some medicine we can use on top that will help the ovaries to respond a little bit more normal.
Right. I would say it's a small price to pay, but I mean, isn't it worth its weight in gold, having good health?
Absolutely. And we're getting ready for pregnancy, so I think that's a great motivator for a lot of women, that this is the time to really kind of optimize health.
Certainly.
Certainly. Ready for pregnancy.
And you say that among the treatments is an anti-diabetic medication.
Yeah, so we can use a medicine called Metformin. Metformin is a medicine that helps the insulin to work better in the body. And how that helps is that if the insulin at the level of the ovary is working better, the ovary is going to respond better to some of our medications. So that in and of itself is not what we use to solely stimulate ovaries, but if we're already on Metformin, we're working towards a better insulin resistance in our body, and our ovaries will respond better to our medicines.
Thank you so much, Dr. McLaughlin.
Oh, you're so welcome. Thanks for having me.
We're back in 2 minutes.